Hello and welcome. My name is Nancy Chen. I'm professor of anthropology at UC Santa Cruz and your moderator today. This is the second event in a series called Inspiring Change in Times of Crisis, Conversations That Matter with Right Livelihood Award laureates, co-hosted by the Right Livelihood Foundation and UC Santa Cruz. And before I begin my introductions, I want to give thanks to the friends of the Right Livelihood Foundation and the Right Livelihood College, especially David Shaw, who is the coordinator of the Right Livelihood College here at UC Santa Cruz. Later on, we'll have the opportunity for those of you participating in the audience to ask questions. But if you have any questions at any time, please feel free to email them to rlc-webinar@ucsc.edu. And that address again is rlc-webinar@ucsc.edu. And please visit rightlivelihood.ucsc.edu or rightlivelihoodaward.org to sign up for our mailing list to receive information about our future events. So let me begin with a few framing notes. The United Nations recently released on April 3rd a report on the impact of COVID-19 on women, which identified 3 areas of concern for women and girls. These include deepening economic impacts, health inequities, and increased gender-based violence. Our conversation today will engage with these topics from the invaluable perspectives of Right Livelihood laureates who've been working on these very issues for decades, long before the global pandemic. After introducing our 3 distinguished laureates, we'll delve into how the global health and women's lives and livelihoods are intertwined. So we're deeply fortunate to have the next 3 laureates join us from around the world. As many of you may have already experienced over the past weeks and months, internet connectivity may be an issue. We appreciate your understanding. And if a speaker's connection drops off, we'll do our best to continue with the conversation until that speaker is able to return. Sometimes we might need to turn off the video. However, the speaker will be present and the audio will be available. Let me begin with my introductions. And I'm deeply delighted to introduce Dr. Seema Samar from Afghanistan. She is the Right Livelihood Award laureate from 2012. Dr. Samar is a medical doctor and has devoted her entire life as a human rights defender in Afghanistan, with a strong belief in education as a mean to development. She has worked as Minister for Women's Affairs. She has been the UN Special Rapporteur for the situation of human rights in Sudan, and now, latest, she is Special Envoy and State Minister for Human Rights in International Relations in Afghanistan. Thank you and welcome, Dr. Samar. Our next laureate, Eva Zielen, who is from Sweden and a member of the Kvinna till Kvinna, Women to Women organization. She was recipient of the Right Livelihood Award in 2002. Eva Zielen is one of the founders of the Swedish organization Kvinna till Kvinna. They work with supporting women's rights to increase women's power and influence, to improve the health of women, to increase information and education on women's rights, and to prevent human trafficking and other types of violence against women. So welcome, Eva Zielen. And finally, Dr. Monica Hauser, gynecologist and women's rights activist, is the founder and executive member of the board of Medica Mondiale. Medica Mondiale's work aims at ending human rights violations against women in conflict zones. Its interdisciplinary teams work with innovative approaches in the fields of psychosocial counseling, medical and juridical support, income generating activities, and advocacy work. With its trauma-sensitive approach oriented on human rights, Medica Mondiale focuses on effecting crisis prevention by working towards a positive social transformation. Medica Mondiale has now operated in emergency aid to protect women's rights in the COVID-19 pandemic. Dr. Hauser and her colleagues have helped over 70,000 traumatized women and girls in war and post-war crisis zones in Bosnia and Herzegovina, Kosovo, the DRC, Syria, and Afghanistan, often despite great risk to their own security. So welcome to our three distinguished laureates. And what I'd like to do is begin with the first question, and we'll go round robin in the order of the introductions. And then we have a conversation with a series of potential prompts or framing questions. So the first question that I would like to invite all of you to address is to ask, what has been the experience in your work with COVID-19 and the dominant, for example, government, corporations, and major public health systems response to the crisis? What has been the uneven health impact of stay-at-home orders? What is happening in terms of both gender conflict and signs of social solidarity? And so we'll go in order first of the introductions with Dr. Samar, and then to Eva Zillen, and then to Dr. Monica Hauser. So Dr. Samar.
Good evening, and it's a pleasure to see you and to be part of this program. As you all know, that Afghanistan is a country in conflict, and some part of the country is post-conflict, I would say. Unfortunately, the majority of the people are really poor, and we have 54% of the population below poverty line. And then the continuation of conflict, still it's going on, although the Secretary General of the United Nations and our president called on ceasefire during Ramadan at least. But so far the Taliban did not accept. So the situation for the people in the country, including myself, of course, I'm trying to stay at home and then try to advocate through different means in order to support the people who are in need. But the unfortunate part is that the majority of the people are poor, and they are depend on their daily income. So they really do not respect the distancing or not going out, although the government is trying hard. The other problem in our country is that we were not really prepared enough. We do not have the kits for the testing and diagnosing in different parts of the country. The influx of the people who came from Iran, actually, when it started in Iran, so they came and they brought the sickness with them, unfortunately. And we didn't have a place to quarantine the people. So they start to go to different parts of the country because they went to their own villages. So they carried the virus with them within different cities in the country. So far, we have around 2,000 cases, as they said, registered cases. But I would say it might be much more than that because we do not have the facilities to test the people. I mean, they are taking some samples from the people, and then it stay for a whole week. And then the people don't know exactly who was positive and who was negative. There was a case from one of the four provinces in the country when they took the sample and give it to the driver, the normal driver who bring passengers from the Daikundi province, which takes 1.5 days. So he came to Kabul, he went back to the town, and then the people asked, what is the result of the test? And I'm sorry that I forgot the sample, it is already in my car. So the lady died already. But I think, yes, it is a new experience for all of us. But I think in countries like Afghanistan, where people are suffering from poverty and a lack of education and a lot of other issues that exist in Afghanistan, they'll be more vulnerable. Um, we have not reached to the peak yet, but it might be not only the current situation, but it will be the after pandemic will be over. It will be a disaster in the country due to the poverty. But I would focus on the impact on women more. As you know, that the majority of the poor everywhere are women. In our country, it's worse. And then the culture also, because if they have small, limited amount of food, usually it is given to the male member of the family and to the children, and the woman will be the last to eat. And that really put them in a more riskier situation than the normal situation, because they will their immune system will reduce and be more vulnerable to catch the virus. And the other issue that which is really put them in a very difficult situation is everything, the shops are all closed. And even when they were in normal situation, I don't know if it was normal before the pandemic, I would not say, because the norm in the societal norm was not based on the principle of human rights. So I don't know if it's normal, you could say, or not. But even the ladies are not able to go and get something in order to do some handicraft, in order to have some income. And that is really very, very unfortunate. And then, of course, if you go further, that staying at home, the lack of access to contraception and reproductive rights, we will face, I think, more violence and more pregnancies, which exacerbate their health situation, and also the number of the children increase the poverty in the country. I'll stop here, but then I can jump on the other part of your questions.
Great. Thank you so much, Dr. Smart. And our next respondent will be Eva Zilin.
Thank you for having us here. And it is an honor to share it with other laureates here. There are so many things. I will not particularly talk about Sweden, where I am, but rather in the conflict areas where we are working. And I wanted to begin, because that is how we do it, by quoting a Lebanese feminist activist that I think many of you know, Lina Abu Habib, who wrote an article just recently about the response from the women's movement. And she said, what the crisis has showed us is that feminist organizing is not only live and kicking, but also creative and resilient and save lives. I think what we can see from this pandemic is the problems that are the ones that hit women the most are not new problems. The problems were there, just as Dr. Samar was saying recently. The pandemic has made them more visible. It has made more visible the many women who are working in the informal economy. It has shown that staying at home is a privilege, although we don't talk about it that much, because for some people you can't stay at home. That would mean no money at all. But also that we actually talk about the lack of financing of healthcare facilities. And the numbers that are floating around now is that 70% of healthcare professionals globally are women. So they are there taking care. They have had lack of money. They have lack of, what do you say, protection gears. Sorry for my English. But they are still there. And when they are not there, either in some places they are not allowed back to their families, but otherwise they are also taking care of their families. So I think that is some of the things that we really see. A worry that we can see already. Yes, we have seen In Lebanon, they say that all the women's shelters are over full. In Israel, they are talking about a 41% raise in cases of sexual violence in the family in March this year, if you compare with last year. We have seen it in every region where we are working, that gender-based violence is on the rise, and you are actually locked in with the perpetrator in most cases. So that is a worry. Another worry is, for me, that I think that everything that has to do with sexual and reproductive health and rights will be deprioritized within the health system, because people will say we need to focus we need to have it for the pandemic, so we can't do this. I mean, I know in the US, where some of you are living, that some states at least have said that abortion shouldn't be anything you do now. So because we need the resources for the pandemic. So you have all the time the things that hits women from different angles. And I fear the restrictions that are in place right now, and more, I see the similarities after 9/11, where it was a lot of both legislations and policies that were really fast in place, and most of them were against people's human rights. And then not all of them disappeared. And I wonder what will happen after the pandemic. Will the surveillance that is going on, and we see that in the countries, I will not even mention which, but the countries where we work, where the surveillance of citizens have already been really, really tough, they have been even worse. And now they have installed so many things on people's phones, and this will be there afterwards. And that will mean for us that the women human rights defenders that we are working with will be even more at risk, because they have to be able to work undercover from time to time. They have to be able not to be openly with what they do. And if they are surveilled everywhere, this will be a big problem. And I think I stop there now so that we can have a more discussion. There are many other things, but these are a few.
Okay. Thank you very much. And Dr. Hauser.
Yeah, I think that many things what Sima and Eva said, we have very similar experiences. But let me start with the effect of Medica Mondiale. With the pandemic, our work was acutely endangered. And in this difficult situation, we started together with our partner organizations to adapt to the restrictions associated with Corona. And we are now working with clients primarily also via digital channels. At the same time, in some projects, the work was immediately adapted to make an active contribution on the containment of the pandemic. To the crisis mode. The reach out to their communities, informing about prevention measures on all levels in remote districts and villages, and sensitized with megaphones on marketplaces, for example, and via posters and by radio. They have organized distribution of sanitary kits, are setting up hand washing stations, giving out gloves, etc., really to make concrete steps. In addition to food packages and water supplies, combining health awareness.
Sorry,
Yes.
Dr. Hauser, the audio seems to go in and out, and we're wondering if maybe you could temporarily just shut the video so then we can hear the audio and then turn the camera back on.
Okay, so I just go on.
Yes.
Can you hear me better
yes.
now?
Yes, we can hear you now.
the colleagues, especially also in Liberia, for example, they are successfully combining health awareness work with education on domestic violence. They can draw again from the experience in education gained over many, many years and enjoy the trust now in the communities and from the village elders, which is hardly an advantage because there are coming big organizations from the capital and people in the communities are not at all trusting. So also, as I said, the digital ways are very important in the moment. For example, regular counseling via telephone, and we can see very difficult situations with the clients due to current triggers. As I said, in Liberia, Ebola, for example, everyone is afraid that the current virus might equally bring death. So it's very important to educate people. Or look to Rwanda. Coincides with the anniversary day in the moment. The fear of having to stay at home, memories of spring in Bosnia and Kosovo brings up memories of the beginning of the war, and the compulsion to be at home as in the war brings up all negative feelings from before. So it's very important to have all these psychological effects in mind. And I would like to end with that what Eva also mentioned, that sexual and reproductive health and rights specific services already in the non-corona times, let me put it like that, in many countries at hand, and even more so in crisis. In the area of sexual and reproductive health rights and services in particular, as always in crisis, we have less access, for example, in the area of maternal health, for example. And we had the case history of a woman in Monrovia during Ebola time who had to give birth on the street, and this lead us birth, and also the access to contraceptives during lockdown is very difficult, as in many countries pharmacies are not accessible in the moment, and women cannot continue to keep control over their bodies. So even in a country like Germany, abortion becomes even more difficult as hospitals never prioritize women's health in times of crisis.
Great, thank you very much, Dr. Hauser. I'd like to invite you to turn your video back on. And I believe the sound quality of the audio was still happening, and we believe it might be the earbuds. So if you actually remove the earbuds, the audio might still work.
Okay.
So great, thank you so very much. Well, I want to thank our laureates for their opening remarks in response to the first question. And I'd like to make sure that for those of you who are in the audience, please send in questions as they come up. Because it's similar to what we would do if this were an in-person conversation. People would normally write on index cards and then send the questions. So please send your questions by email to rlc-webinar@ucsc.edu. So please make sure to send in your questions. In the next 25 minutes, what we're going to do next is to engage our distinguished guests and laureates in conversation. And many of these initial framing questions are more just an opportunity for the laureates, not so much to go round robin, but really to engage each other in questions. So the first topic has to do with the economy. In many parts of the world, everyone is concerned about the economy, and this is exacerbated, of course, by the COVID-19 response. However, many of your work and the organizations that you've worked with show that putting women at the forefront of economic recovery continues to be the foundation of building just, equitable societies for better futures, that we pull up women and girls, that this is the way to make a better world. So I'd like to invite the laureates, if you could please share some examples and your experiences with the community-based organizations and advocacy that you have engaged in to help alleviate the role of women, for instance, in unpaid domestic work, caregiving, childcare, all the things that have become exacerbated in the COVID-19 pandemic response. And so the floor is open. But it seemed like all of you had responses or suggestions that you would like. Maybe we can maybe begin with a different order. And Eva, I can ask you to start, but the conversation should be anyone who would like to speak up next.
I can start, and I'm sure, I think Seema was talking about that she already had a lot. I think it's also some of the things are too early to say what will come out of it. What I hope also will come out of when it comes to the economic is that we are actually looking at what is needed. I think, for instance, in a country like Lebanon, it has become even more, people are even more aware, at least the ones who cares, that the migrant workers, as well as the refugees, especially the migrant workers, they have no access to healthcare. They don't have access to bank account. They are the people who need to go out to earn the money, because I think when we are talking about, here in Sweden, we talk about risk groups and everywhere, and we have this particular risk groups. If I go to Sweden, we talked a lot about the elderly and people with certain illnesses. We forgot that we have a big community in Sweden that might not listen that much to Swedish news because they are not original from Sweden. And that's where we have the most deaths now. So it's also, and the same goes in all the places where we are working. If you are trying to get information out about what you should do, and that would also affect how you can get your living, not everybody will get that information. Maybe not on the right language, but even so, they wouldn't even have the access to where the information goes out. And in most places where we work, it has been so much, sorry, now I'm not answering the question, but anyway, there has been so much misinformation. And I know that a lot of our partner organization in Bosnia, in DRC, and in many other places have started to try to get the right information and how to deal with it as a woman on the radio, where that is more appropriate, in podcast where people actually have access to Wi-Fi. But it also has become this, if you don't have Wi-Fi, you can't do much. And if you don't have money for the day, for food, you will not care about the social distancing. And a lot of women are in this sector or have had work that is so badly paid. So it's not like you have a lot of money in the bank, and it's not work that you can do from home. I mean, I can sit and say that I'm tired to have been working 7 weeks at home, but I can do that without problem. I can sit here and talk to you without problem. And I think that we will talk more about what the money is there for, what kind of economy do we need? I don't think everything will change after the pandemic. Unfortunately, we'll go back to a lot of things. But we do have arguments here that military is not the way to get the security, because they can't really stop this. And if you are poor, this is going to hit you worse. So how can we build a society that is this new slogan, home together? So that we are not home together. We're really not home together, because I can be home together in a totally different way, and most of the people I work with, which is totally unfair. And I think for the women, now I'm really off the topic, so maybe you should go before I go into something else. But I really, really think that when it comes to the economy and the breakdown of the economy as we see it, it will hit women more. And in the most vulnerable and poor groups, it will also add on to violence in the communities, I think. And that will also hit women. So if we want that to change, we need to take some lessons learned from this pandemic. What have we seen as the real problems? And there is where we need to put the money. Sorry.
Thank you. Maybe Dr. Samar, would you like to also, you had addressed also in your introductory remarks.
Yes, I think in our case, it's, as I said, that it is worse because the people in the country, the majority of the people in the country already was not employed. So imagine if they had the something to do, that is also not um, available these days. So what the government planned to do, divide some food to the people, but then when they take some wheat or some lentil or oil, then it will be more people who comes and they do not really keep the distancing. They are not wearing masks. So it is in a way that the whole poverty push the people, make them more vulnerable to be infected because of these gathering and crowd that they make around the mosques when they distribute some food. The other issue that I think is as I mentioned, the priority when there's a sick person within the family, the priority goes to the men, and they carry the men to the hospital, and even if it's needed to another province, because in most of the province in the country we do not have the facility to diagnose, to do the test and take the sample. So the prefer would be given to the men, male member of the family, and the men in the family, rather than women. The other issue that we really see it more, as I mentioned before, that the few or very small private hospitals that exist in the country, they're shut down because they do not want to be caught, to catch the virus. So the governmental hospitals only deal with the coronavirus, I mean, specific hospitals. So the priority is not given to reproductive rights of women, let alone about the contraception and so on. Because they are at home and they are depressed. So one of the issues usually done in this situation during the conflict or non-conflict, when they are staying closer, then it will be more demand for the men in order to have intercourse. When they refuse, then they will be beat up. So the increase of the violence within the family because of this being at home, not doing much. Usually the men are out, do some physical work on scale labor. So this, I believe that it will, one of the reasons which increase the violence within the family. And then of course, increase the violence and increase the poverty, facilitate the child marriage and forced marriages, unfortunately. Because this is a time for some, let's say, rich opportunist people in order to get a younger girl, 13-year-old, as a wife, as a second, or as a third wife, or as a fourth wife. So there is unfortunately increase on forced marriages, child marriages, and so on. The other issue that even for us, because the police is busy with currently with pushing people to stay at home, rather than really dealing with the cases of violence against women. Even if we have cases of violence against women, police is not there, prosecutor is not there. So they can't really go, and they cannot really raise their voices. I mean, the one who are already educated and have phone, and they have my phone number or Medico Mondial's phone number or somebody, they might, but the majority do not have that access and that luxury, I would say. The other point that our friend from Sweden mentioned, in our case, the awareness among the people is not really high enough. And they are out in the street and they say that we will die anyway from either from hunger or from corona. So I prefer to die from corona, not see my children to die from hunger. So it's really difficult. And then the impact, as I said, that it's much more on women in the family than the men in the family. And I think the other issue that I would say that make difficult because of saying that it's COVID-19, there's not a lot of social services for the victims of violence against women. As everything is locked almost. I mean, practically the governmental institution is not really functional. You can't find people. I mean, it was difficult to find in so-called non-corona situation, as Monica rightly said it, because we, at least in Afghanistan, we are not living in a non-corona normal life, I would say. As I said, it's not normal anyway, but it's getting much worse. And the impact on those people, a lot of people lost their jobs, first of all. And secondly, particularly women who are headed the household is very, very vulnerable to the impact of economical impact of the pandemic in Afghanistan. I will stop here.
Great, thank you. So Dr. Hauser, would you like to also address this question, or would you like to continue the conversation and take it in a different direction?
I hope you can hear me now better.
Yes.
Okay, so it was the earphone. Yeah, I just would like to add to my colleagues that women really have no choices, no choice between staying at home in order to be safe of the virus, or to feed the children. So of course, a woman goes to the market to sell her products in order that she has some money for food for her children. So they have really no choice. And this is one thing. And the other thing is, what means security at home? We see, as Eva also said, and Sima, we see very high increase of domestic violence, intimate partner violence, as we put it, in all the project countries where we are working. And also, I can say, I speak about experiences in Kosovo or Bosnia and Herzegovina. Our colleagues there in Bosnia are very experienced in counseling about these issues. And now the SOS telephone hotline, or the regular counseling by telephone, is really a very, very helpful tool. But all the problems which were before, I only can pronounce this, or we all pronounce this again and again, the problems we had before are aggravating in the moment. For example, there was one case that a wife, in her panic because of a violent husband, called the social welfare office, and this office remained completely indifferent. Her husband became more and more brutal. Then she called the police, and the police responded with laughter. So she called Medica Senica, which immediately gave her some psychosocial support. And they again called the police. The police came quickly, and her husband was removed from the apartment. But it took so much time, and it was such a long way for her. Or another case is the problem of the reactivation of war experiences. For example, a young mother of 2 kids who was many times raped during the war times, now experiences massive psychological problems because of the lockdown and because of having indifferent fears. So she called the SOS hotline, and Medica Senica could calm her down. I think with the health effects, also the complete concentration on one topic only leads now to a huge problem in general basic healthcare. WHO says that Ebola killed fewer people than malaria or deliveries. So there's a great danger also in the moment that the vaccination programs for measles and polio will now have to be scaled down. And we can be sure many children and young people probably have to die as a consequence of this. And all in all, if I can speak shortly about the gender effects, we have to fear backlash now, as women are now forced back in their gender stereotypical roles, as Eva put it before. And also the existence for the women is immediately threatened by precarious working conditions. I would like to tell you a short example from our colleagues from organization Emma in northern Iraq. We can see that the young colleagues now working at home, that they are controlled by their families, and the family is not accepting that they work for hours and hours on their laptops and computers at home. So a consequence is also that for the directors of our partner organization, it's very, very difficult to keep their staff together. So these are also effects which make the work really very difficult. And maybe my last point here, we know that so-called vulnerable people are now very marginalized. I don't like the term vulnerable because nobody is vulnerable by nature. So we have patriarchal structures who make women, for example, vulnerable. I prefer the term threatened. But these people are very marginalized, and we must be vigilant and support especially such marginalized communities and support them in solidarity. And looking to health, my last remark, I think that WHO, the good work they do, but they still are thinking in patriarchal patterns very often. For example, they have not considered the gender-specific differences in such a pandemic with massive implications for women, because women in community life play an important role and so are very relevant in early detection of changes. For example, whether there are more infectious people also in the community. But as they are not involved in monitoring systems, just not involved, nobody can detect and can value that they could be early warning people. So structurally, we have still a lot of mistakes, and in such situations of crisis, we see the more the problem.
Exactly.
Great, thank you very much. And I just want to remind the audience that if you have questions, please send an email. We will be in about 15 minutes taking questions and sharing those with our distinguished laureates. So please send it to rlc-webinar@ucsc.edu. So many of you already have talked about the uptick in violence, both domestic violence as well as just the structure that women are facing. So I'm wondering if you can please address what might be some effective approaches for safe spaces, whether in the household or in the community. What are ways in which safe spaces might be possible to be created for women and girls? Hotlines, for instance, are working overtime in order to try to address the uptick in domestic violence. Are there other examples or ideas that you can share from the community partners that you work with, as well as your organizations, that would be inspirational or hopeful to share with in other parts of the world?
Who should go first?
Maybe Dr. Samar, since you asked the question, why don't you?
Yes. I think, unfortunately, in our situation, we are not in a position to create a new structure or safe space. But even the shelters that exist in Afghanistan, first of all, it's not a lot. Secondly, they are more, how to say, it's more overwhelmed because of the COVID-19. We did a lot of lobby in order to release a lot of prisoners from the jails in Afghanistan, including some 500 something women who were in jail in different parts of the country. So the priority was given to women to be released. Family, where they should go. We really could not find a solution quickly for them, because to establish a shelter in this country is really struggle in order to do. We need to have a funding or so on. I don't know how many, I don't have the exact number, but most probably very, very few of them who were in a very difficult situation, or as Monica said, threatened situation, if they were able to be in the shelters. I don't know where the others gone. Unfortunately, we were not in a position to check. Actually, this is the job of the Human Rights Commission, so I'm not anymore in the Human Rights Commission, so I couldn't follow it. The other point is that I think it's always depend on the culture and so on. The situation is, some Afghan men who are educated or so on, and they say, I'm helping my wife on cooking. But you can say that you're just doing share of your work. You're not helping. You should not really put a lot of, let's say, to be proud that you just washed some dishes or you cooked something today, but you just did your share, not enough of your share even. The overall structure, the patriarchal society system in the country. If you look at our government who established this COVID-19 response, the absolute majority are men. They really don't really pay attention. We had to lobby, including myself, because there were some pregnant women in Herat when the first COVID-19 pandemic started to be realized or diagnosed there. A woman who was pregnant early in the 9th month of her pregnancy, and then she was saying that she's working for 12 hours. So I sent to the information to the person who's leading the process, and then finally they were able to just say that they should be at least not in the duty for 12 hours if they want, if they are volunteer to do, but otherwise she will be more at risk with full-term pregnancy, standing there without really enough protection. So in fact, the medical staff were more at risk than anyone in every society, not only in Afghanistan, but particularly in a country like us, where we don't have any or enough protection for them. So these are the issues that really we could see that, of course, we do not give up. We try to support and protect. And the mothers who were breastfeeding their babies, we were able to convince the government that they should be on leave during this COVID-19. So the pregnant women, even if they were not working in a medical, as a medical staff or in medical field, they were given some kind of home leave with salary. But it's a small number of women who are doing. And the other issue that on education, you said, unfortunately, the children in Afghanistan, first of all, they were not always, even if they are if they are going to school, they're not going for a whole long time. I mean, it's 2-3 hours, particularly for the younger children that they go out. But still, let's give a little bit of time for the mother maybe to breathe, but it's more work. It's more work with the too many children that we have in our families. The children actually, and particularly if they are poor and they're fighting for a piece of chocolate or a pen, then the violence against women will increase.
Mm.
So stop here.
Thank you, Dr. Smar. Would Dr. Hauser or Ms.
Yeah,
Simon, would either of you like to respond?
Just shortly to add to Seema. Seema, it's not only Afghan men who tell their women, can I help you? I think Eva and me, we know that this is also an issue we have in Western European countries. And I'm really wondering how it is at home now when women are going on with their work in home office and of course doing in the same time householding, having the children. And I know from many of my German colleagues with small children that they are really overburdened, and it's a big stress for everybody, and especially for the women, of course, as we just said before, that 75% of everybody in the care work is done by women. But I think just to close this point, I think I also see in the international world, but also especially also in the German world, men in the general discussion in the public discussions are occupying the rooms. And so they are occupying the discourses. They have very loud voices and are heard. And I can see in the many talk shows now in Germany, for example, 80% of the participants are male. So I think we must not allow ourselves to lose the sovereignty to interpret and express our realities and the realities of the women of our colleagues in our project, of our partner organizations, and also the women they and we all are working for. So it's very important again and again to speak about the realities, as we do tonight or at this morning in your case. So I'm very happy that Right Livelihood Award and you have organized this issue, because we have to make our feminist definitions, and we have to bring ourselves into the discourses that our voices and the voices of other women are heard.
Yeah, I will tag along on that one, although that was a wonderful ending, I think, because I think it's also important. I mean, safe spaces. Yes, you do have some type of safe spaces, some places with that you do have a phone number to phone, or I know that in my colleagues who live in countries where they are much more, we are quite free to walk around. They are not. That at least maybe for colleagues with small children to be able to be in the office from time to time, not many of them, maybe one at a time, that is a safe space. I was actually wanting to ask Monica how you are doing, because one of the things that we can see with our partner organization, I mean, you said this with a lot of staff that if they are young, they are not sort of allowed to do, they are more controlled because they stay at home. For us, it's also been a question that so many, yes, you still have the SOS hotlines, but people are answering it at home. So they bring the caseworkers, sort of, they work with the women victims that they might not be able to help as much because of the situation and because of a lockdown. They have it in their homes. So we can see that not only because the women's days are awfully long, when they have children in different ages and they help with homeschooling in the middle of the day and maybe work a bit with their job in the morning and then in the night after the children has gone to bed. So the day becomes enormously, but we see already a very psychosocial fatigue, and it also comes together with what you have said and what many of our partners are talking about, the re-traumatization, both in countries that remember conflict, where this was sort of what they had to do, or in the Ebola countries. I would say it's the Ebola crisis a lot. So how do you tackle that? Because it's kind of your speciality. So I'm going back to you, Monica.
Good.
And you're muted, Monica.
It's not good to mute myself. It's not my intention.
Nobody will mute you, Monica.
As
You
I
know
said,
how loud you are.
as I said before, that it's very important, the experience the colleagues have gained in the last 20 years. In Bosnia, for example, the colleagues from Medica Zenica since the war, 93, so it's 27 years of experience in the meantime. And together we have developed a trauma sensitive approach, what means to build up a stability and security in the relationship between the counselor and the client in order to support her and to give her back at least some control about her own life. And of course, this is absolutely endangered in the moment in terms of that colleagues cannot reach out anymore. We have some countries as Liberia, for example, where they can go out to the villages, to the communities till 3 or 4 o'clock in the afternoon to do the work there. But in Bosnia, for example, we also have lockdown, and therefore, as Eva mentioned, and I also want to pronounce that they switched completely to counseling and SOS hotline, and this is really very supportive, even in such a situation. And but of course,
but how do they take care of themselves? Because I
yes.
find that some, even the experienced one, suddenly they don't remember the debriefing or anything, and they are just the work is never ending because they do it from home.
Yes, the work is never ending. And just yesterday, a colleague who is supervising counselors in Kosovo, she told me that she made some kind of new structure with them, that in the morning they shall dress themselves and make some schminka. And sit at the phone as they would like to go to work, but 4 or 5 o'clock in the afternoon to stop. And even when women are calling again and again and say, I need you, that they really start to say to themselves 4 or 5 o'clock, I have to close my phone, I have to stop. And we are joking because then they take a shower, and to take the shower in the late afternoon means now I'm a private person. This sounds so easy, but it's so difficult for colleagues in all these countries who have never learned to say I. What do I need? It is impossible for them. So it's really very difficult now, knowing that so many women are in difficult situations. It's a hard exercise for them now, but they learn this. And as I hear, that it's very helpful. And because of these problems, Medica Mondiale has developed self-care, self-care exercises. And on our webpage of medicamondiale.org, you can find such kind of specific self-care exercises in this situation now. And maybe I also could send this to Right Livelihood Award, and you could distribute it and have it on your homepage in order that people can benefit from the exercises we have worked out.
Mhm.
Wonderful.
Good.
So what I'd like to do is to make sure that if there are any questions from the audience, this is the time to submit your questions by email. Please send them to rlc-webinar@ucsc.edu. But while we are waiting for any questions, and if there are no questions that come up in the next 3 minutes, what I'd like to do while we're waiting is actually ask the laureates to each interview each other. This is a rare opportunity for all three of you to be together. So maybe Dr. Hauser, since Eva already posed a question, I'd like to ask you to pose a question to your fellow laureates, what you would like to know about their current situations in terms of their partners, their community organizations, their regions. You know, if you can ask a particular question that you would like to know of either Dr. Samar or Eva Zillan.
I would like to ask Seema, as I know also the Afghanistan, and I can imagine how incredible difficult the situation there is now, additional to the very difficult situation we had already before. So Seema, how are you in contact with your with fellows, with other activists in order to strengthen each other? Is this possible at all in the moment? So how do you contact each other is one question. And the other question is, in the beginning you said, you spoke shortly about the Taliban. I would like to ask you, is there any idea about the peace talks continuation in such a situation as now?
Thank you, Monica. We do contact each other through WhatsApp. We have different groups, different WhatsApp groups, and we just write to each other, or if it's needed, we call. The unfortunate part was yesterday and the day before yesterday, and today I was very busy because there was a cases of rape by police officers in the district where I come from. And the people saw the police and the woman, and they then followed them, unfortunately. So it was a big demonstration, and then the people came to protest against the police. And police should not really take part on these issues. But then the police fired on the people. One young man died, and 9 others were injured. So the whole day I spent the time with calling the Minister of Defense, the Minister of Interior, the other related people, in order to send some people and to stop the whole thing. And that is the people who are calling me. So thanks to the technology, we didn't have this facility or this luxury 20 years ago, when it was too many problems. On the peace talks, unfortunately, we have the political tension between the two candidates, President Ghani and Dr. Abdullah, and it's not solved yet. And then, of course, the internal problem or tension within Afghanistan makes the whole things problematic and difficult to go with a united approach to Taliban. So there was agreement between the Afghan and the Taliban and the American, as you know. They were supposed to release 5,000 Taliban prisoner, and the Taliban would release 1,000 of Afghan, they say, Afghan security forces, but the majority of the people are the civilian, which were taken hostage by the Taliban, because they didn't have 1,000 people as hostage. So they actually took more civilian hostage recently in order to complete 1,000. So on that, there's a negotiating team established by the president with 21 people, 4 women, supposed to be 5, but then they put only 4. They remove one of the women from the list and then put another man instead. So they're waiting for, I don't know, it's a discussion that they will establish another high peace council, which we already had. So that one is, I mean, was not functional, and then they cut the budget and everything. So they are preparing to establish another one. So the Taliban keep their military pressure on the security forces. In the last week, we had more than 100 people who were killed by the Taliban. And even today, there was a suicide attack. So 3 people were killed and another 7 to 10 people were injured. So the violence continues, unfortunately. And the tension between the government, I think, as I said, that the case in Jogri district yesterday, and the police is participating on these cases of sexual violence or sexual activity. It is Ramadan. During Ramadan, they do this. I mean, they claim to be the Muslims, and they claim to be, I don't know, they should protect the people. I mean, even if it's a consent, sexual, whatever relationship, they should not be done publicly during Ramadan. So it is horrible. So I had a really tough 2 days. The other point that I would like to mention, which was not, Monica, was not in your question, but I would like to mention that the fundamentalism and right wing is on rise, not only in Afghanistan, but it is in Pakistan, it is in India. You could see the Indian Hinduism and against the Muslim. And then we see it in Afghanistan because they refuse, some of them, to close down the mosques. In the mosque, you can see that nobody really keep the distance, nobody keep the wearing mask. So it is, they keep saying that if a Muslim die from the coronavirus, they will be a martyr, they'll be shaheed. So it's so crazy. I mean, how they misuse the religion in order to influence, in order to promote their own ultra radical Islamic views. I hope I did answer your question.
Nancy, may I ask also Eva a question?
Sure. We should probably go to our last question, which is to envision 2 years from now. So if you can just ask it quickly, and then so we have probably 2 minutes.
I'm afraid that this the answer would not be that short enough. I wanted to ask Eva, because we are both part of a new feminist network called FIRE, and we made some feminist principles for ceasefire, as Mr. Guterres has put it, to have now a ceasefire. And maybe Eva, I don't know, is it possible to answer very shortly about that?
On what? To say the principles?
Yes, please. Would be great for the audience, I think.
Yeah, I think it would be great for the audience. I don't know them by heart. So, but I think, yeah, but I think it is very much what you have said earlier, that we need to see what is needed to be done, and we could see that we needed feminist solidarity.
Yes.
When it comes to the UN Secretary General's, it's really good that he says that it's going to be ceasefire. But I was thinking, Seema, we're talking about that they are talking about ceasefire during Ramadan, and here it's like during COVID. So are they going to start fighting afterwards? Is that okay to kill people with weapons again? So, and we felt like there was a need to also ensure that you did look at women's rights, because it has been really gender neutral in all of his discussions, I would say. So, and to have that at the same time, because I just want to add one of the things that Dr. Sima Samar was talking about, that the mosques are open. In Georgia, the Orthodox Church is open. The priests have been openly saying that they don't really follow. It's totally locked down for everyone else. And it was the Orthodox Easter last week. So instead of telling the priests that they needed to follow the rules, they did, instead they had a much harder lockdown, and nobody was allowed to go by car, because if they were not allowed to go by car, at least a fewer people would be able to reach a church. And it's been said the same things, I think, that if you die, I mean, if you come there, you are, first of all, you might go to hell if you don't attend the mass during the Easter. So there you go for social distancing. But also that you are kind of, I think they wouldn't say martyr, but it's the same. It's the same language. And I think that we also need to really look at this. It's already been for a long time, this nationalistic and anti-gender and whatever you call it. And this has become even more prominent. In Armenia, they say that it's the homosexual and the women activists who have brought the coronavirus. So you have this different, very negative narratives going on. So it is, and sometimes I just wonder if they sit in a little room and learn from each other, so they say exactly the same, even if they would never say so.
Absolutely.
Because,
yeah. In our case, they said that the coronavirus is because of women existence.
No.
Yes, yes, exactly.
They are sitting in the same room for sure.
Yeah.
Yeah, they are sitting in the same room. Sorry, we are totally, we're doing it like anarchy.
This is an amazing conversation, and we have reached the time. So in closing, what I'd like to do is ask each of you to imagine 2 years from now. And many of you have, all of you have different concerns and issues that have been exacerbated by COVID-19. But if we're successful in seizing the opportunities at this moment, what are the most important or significant advances that we have achieved or can be achievable, say, 2 years from now? And so this is just a short closing question. Each of you have 1 minute, 1 to 2 minutes to just give a very brief response about opportunities that should be seized, that could potentially make a difference to advance and make the world a better place for women and children. And maybe we'll go in order of Eva, Monica, and then Sima.
Okay, am I muted? No, I'm not muted. Thinking positive, that is. I would say that everybody have read our 5 principles for the feminist peace and realize that if you want to build security, you need to look at the inequalities in the world. You need to put women in position where we are actually also driving the agenda, not there as token women or caretakers, but we are also the ones putting on the agenda what is needed. I do hope that you see that it is a necessity to have good healthcare system. And I do hope that the people who have now not been in school will come back to school, and that we will make it a priority that goes even for the girls. That was 1 minute, yeah?
Yep, thank you very much. Dr. Hauser.
Yeah, it was great. Eva has mentioned already the important points. I just can add that hopefully this situation has helped us to lay down the structure for much more gender justice in all the fields we have spoken today about it, and that care work is done not at all anymore, especially by women. And I think the polarization and the stigmatization, what we can see now, is not good for any of us, and it leads to social disaggregation and division and exclusion. And I really think we have to work now against this, and rather create connections and solidarity in order to that everybody can benefit and will not be excluded. This is something I'm really very worrying about. And so connection and solidarity, I think this is the most important what we have to create now together.
Great, thank
Yeah.
you,
On
Samar.
top of, yes, on top of everything that my colleague said, I would say that I hope that we learn from the mistakes that we already did and not focus on militarization and making more bombs, rather than really spend the money on health and education, because the countries who has the most advanced weapons could not really stop the virus, and they have the highest number of the casualties because of the coronavirus. We should learn from the mistakes that we did, and we should promote human rights and equality everywhere.
Very important.
And thank you very much.
Yes.
Yep.
So I want to thank our distinguished Right Livelihood Award laureates. Thank you so very much for your incredible inspiration for the work that you do. I want to thank the audience members for participating and joining in this. As well, thanks again to the Right Livelihood Foundation and the Friends of the Right Livelihood, as well as the Right Livelihood Colleges. Please don't forget that next week will be the third event in this series. It will be on May the 6th, and the topic will be environmental activism in the age of coronavirus. So thank you again. Thank you so much from Sweden, from Germany, from Afghanistan. You bring incredible insights and inspiration. We're just very grateful for the ongoing work that you do on behalf of making the world a more just place. So thank you so much.
Thank you.
Thank you. And thanks to Right Livelihood Award Foundation and all of us, the whole family, I would say.